We know that the spread of misinformation is costing lives. We have patients that may not come in until the last minute because they still just believe this isn't true.
We've had patients who are diagnosed saying, we don't believe you, until they're in the ICU. And the nurse they finally tell their nurse, okay, I believe it.
Otherwise completely healthy 30-some-year-old will come into the ER and be short of breath and not understand why.
We have people in the community calling it still the China virus. They talk about how, this was all a big hoax.
Just this week, we have an ICU patient who came in extremely hypoxic, so his oxygen level was very low, and he was in complete disbelief that he had COVID, and he was struggling for breath. He was scared to death. He was screaming in between every breath, I can't breathe, I can't breathe. And ultimately, he ended up on the ventilator. But up until that point of knowing that the ventilator was what was next, he still did not believe.
I tried to get him to go to the hospital and to the emergency room because he was having problems, and he just wouldn't go. And the friends that I know that I've heard have it, I'll contact them and I say, if you have the least bit of problem breathing, I said, take yourself to the hospital right away. It's a real thing, and I want people to take it seriously. I don't want them to end up like me. I lost the love of my life.
There's been a lot of misinformation, a lot of distrust. That's not just here. We're seeing it all over the country. We don't let people drive drunk. We don't let people drive fast through school zones. Why? Because if you drive drunk, you're going to hurt somebody. If you drive too fast in a school zone, you're going to harm a child. The same thing applies here. What is the downside to doing everything you can to stop the spread of this disease?
It's difficult sometimes for the families to realize how sick their loved one is, especially if they have been in that mindset of not believing that this is real.
It helps having some chest x-rays to show them, to try to explain how the virus works. But a lot of people, they kind of just, it's hard for them to understand.
It's challenging to come into work each day, work as hard as you can, and then still experience people that don't believe that COVID is really real. I just wish people would believe that this is real.
At least 2 companies here have confirmed they're testing vaccines in children as young as age 3. State-owned CNBG, China National Biological Group, is doing phase 1/2 trials with 2,000 toddlers and younger kids. Yang Xiaoming is the CEO of CNBG. He says that so far, data from their trials with little kids show that their vaccine candidate is safe. We haven't observed any reaction different from those in the adult group, he says, adding it was hard to recruit for the kids' trials. The one-child policy that was in place for decades here has meant there just isn't an abundance of kids. Plus, companies need to get consent, not just from a child's parents, but from their grandparents, too. Sinovac, a private company, is testing its inactivated vaccine, it's called CoronaVac, on 500 children in Hubei province.
Do you feel it's risky doing trials with kids?
The risk of using it in children will not be greater than that in adults. Under China's emergency use authorization, nearly 1 million adults have already been vaccinated. Children have accounted for just 2.4% of confirmed COVID-19 cases that have been reported across China, where there is also a lingering skepticism around vaccines after a string of scandals. The latest was in 2018, when one Chinese manufacturer was fined over $1 billion for faulty vaccines that were injected into thousands of babies and children. There were no reports of illness because of it, or worse, but it really shook confidence among Chinese parents. That uncertainty is why some U.S. experts are cautious about moving too quickly to inject vaccines into little kids before they've been fully proven in adults. That COVID-19 vaccines are being developed at this pace is unprecedented, and for kids, it's uncharted territory.
What you want to do is make sure, because of their vulnerability, that you have a product that you've already shown is safe, and efficacious in an adult population.
The U.S. has had more than 1.3 million cases in children. They're generally more mild. A study from the spring and summer found that the hospitalization rate for children was only 1/20th the rate for adults. But still, some ended up in the ICU. It's part of why a group of experts backed by the American Academy of Pediatrics argues that little kids can't get left behind.
Yeah, it is critical to help ensure that we understand the safety and the right dose to be used in children.
What's the risk of waiting any longer to start these trials?
I think that the window for having a vaccine fully tested and available for children is rapidly closing before next school year.
Trials for really young kids are approached a bit differently because their immune systems and immune responses aren't the same as adults or even older school-aged kids.
It's a very different ask if the vaccine is 95% effective and the side effect profile looks like other vaccines. So I think that's what we do. We have adults lead the way. Our first responsibility is to do no harm, and that will always be the fundamental tenet of any of these trials that we do.
At this stage, it isn't clear when kids might get a COVID-19 vaccine that could help normalize school and salvage playtime. Experts say there's no question that trials with little kids are critical. It's a matter of when it seems right to do them.
In New Jersey, health officials are working to build public confidence in the COVID vaccine. The first person in the state to get that shot talked with NBC News correspondent Antonia Hilton about the importance of trust, especially among minorities.
Hey, Allison. So this is the site where the very first people in New Jersey to get the COVID-19 vaccine received it this morning around 8 a.m. University Hospital in Newark. Right behind me here is the vaccination clinic that they have set up. Their employees, frontline healthcare workers, have been coming in throughout the day to get their shots, and their goal is to get about 600 people vaccinated a day right now. I spoke to the very first person to get the vaccine this morning, a nurse, a Latina woman who reflects a lot of the community that this hospital actually serves, and she really had a message for the people of Newark here. There are a lot of Black and Latino neighborhoods here where there are anxieties and fears around this vaccine. For Black folks, it has to do with a history of experimentation on Black patients and distrustful relationships with medical institutions. And then for Latino folks and for immigrants here, many of them have had negative experiences in the medical departments in our immigration system. So take a listen to what this nurse had to say.
We think about modern day today. We still have people that, let's talk about ICE, right? And what's been happening to the ICE detainees, right? Again, with hysterectomies, were they really necessary? So I understand their fears, I do. But I'm here to say to my community, to my people, to my Latinos and to my Blacks and to just everyone around the world, this vaccine is safe.
The CEO of this hospital, Dr. Sharif El-Nahal, told me that trust factor is going to be the major bottleneck as the state tries to reach herd immunity. And the goal is to get about 70% of the adults in New Jersey vaccinated in order to get to that point. That's about 4 million people. The state has 76,000 doses of the vaccine on hand right now. So you can see they have a long road ahead to get to that point. And their goal is going to be sending healthcare workers like Maritza out to talk to people, answer their questions and recognize their fears, and hopefully get them ready and comfortable taking this vaccine.
A COVID vaccine is here and another could be on the way. The FDA, as we've been saying, will likely authorize Moderna's vaccine by the end of the week. Dr. Moncef Slaoui, the head of Operation Warp Speed, saying the vaccine could prevent spread of the virus for months and protect you from the disease for years.
My expectation is that prevention of disease by these vaccines will last quite long. Maybe prevention of infection to the level we are seeing maybe shorter lasting, maybe it lasts 3, 4, 6 months. When prevention of disease, in my humble opinion as an expert, is probably going to last a year, 2 years, 3 years.
Emergency medicine physician Dr. Regina Bizet joins me now. Dr. Bizet, it's so great to have you here on such a celebratory day, if you will. The FDA releasing documents today saying that looking ahead, Moderna's vaccine is 94% effective. It appears to prevent the spread of the virus. They'll review safety later this week. What are you looking out for there?
I don't think that the FDA has any reason not to provide emergency use authorization to the Moderna vaccine. The Moderna vaccine has a very, very similar safety and efficacy profile to the Pfizer vaccine. 94% effective, great effectiveness against preventing severe illness. No one in the Moderna trial that got the vaccine developed severe COVID-19 disease, and that's a very, very important point. Recently, after they submitted their documents for the emergency use authorization, they submitted an addendum with a hint that the Moderna vaccine could also potentially prevent asymptomatic COVID infection. So that's something else that we have to be on the lookout for from the Moderna trials as well.
Vaccines are here, but we know things are still pretty bad right now. What are you seeing in your Texas ER, and what do you want our viewers to know while they wait their turn to get vaccinated?
I think viewers should know that it's going to be a while before the general public gets vaccinated, as the reporter just mentioned. Right now, we're focusing on those that live in nursing homes, long-term care facilities, and those who work in the hospitals. Second quarter of 2021 is probably an ambitious goal, but that's the earliest in terms of when the general public is going to start getting the COVID vaccine. Until then, wearing masks and social distancing is going to be what we have to continue to employ if we want to keep this virus at bay, and if you don't want to succumb to any illness before you're able to get the vaccine. The emergency departments in Texas and in the Houston Medical Center are full. We are saturated. Last week, we got to a point where our ICUs were past capacity and we were actually using our surge beds. Right now, that number has gone down just a little bit, but in the Texas Medical Center, we're still at 97% ICU capacity. For people who are sick enough to get admitted to the hospital in the Texas Medical Center, there's a 9% death rate. That means that 1 out of every 11 people that gets admitted to the hospital with COVID isn't making it home to their families. This is not a game. This is not a joke. And yes, we're celebrating because we have a vaccine, but we still have a lot of work to be done.
Very important reminder. Thank you so much. We know the FDA also authorized the first over-the-counter at-home COVID diagnostic test today. What do we know about that test, and how will this help with the testing challenges that we've seen across the country?
So, Allison, interestingly enough, it's not the first at-home test that's been given authorization by the FDA. The FDA actually authorized another test about a month ago, actually, by the Lucira company that's for at-home use. But the difference with that test is that it required a prescription to be used. I haven't heard a lot of buzz about that at-home test because I don't think physicians are actually giving prescriptions for people to test themselves at home. While these at-home tests could potentially help us with the access to testing that we've been screaming for since the beginning of the pandemic, there also is a downside in the fact that they can give you potentially false positive and false negative results. Now, a false positive COVID result may be a little bit anxiety provoking, but I think it's probably a lot less dangerous than a false negative result. If someone has reassurance that they think they don't have COVID and they're potentially spreading disease.
Over in England, health officials say that they've discovered a new strain of COVID. What do we know about this new strain? And could it make our new vaccines ineffective?
So it sounds like there's been a small cluster of cases in the south of England. They've discovered about 1,000 cases of this new strain of COVID. I don't think that we should get all in a tizzy just yet. The natural or the nature of viruses is for them to replicate and for them to change in order to try and evolve and escape the things that are killing them, such as vaccines. That's the reason that we have to get a flu vaccine every year, because the flu mutates and it changes. Same for COVID. I don't think that we've noticed any clinical significance just yet from this new COVID strain. So there's still a lot to study and a lot of work to be done.
Dr. Bizet, I know you are so busy. We are always so grateful when you make the time for us on News Now. Thank you for being with us today.
Thanks so much for having me, Allison. Good to see you.